Now, one more thing we should understand regarding this is gain of the system. Gain of the system is a measure of effectiveness of a control system, and the formula for gain is correction upon residual error. That means how much it is correcting the variable, but still how much is the residual error. So, let us try to see one example and understand what is gain of a system. Suppose normal blood pressure or reference point is 100 millimeter mercury. Now, suppose there is blood loss, and this blood loss can cause change in blood pressure to 40 millimeter mercury. So, we are assuming here that there is no control system which can correct the blood pressure. So, if blood loss can cause the change in BP to 40 millimeter mercury, there is a change of 60 millimeter mercury. So, 100 minus 40, BP has fallen 60 millimeter mercury. So, current value is 40 millimeter mercury and change without regulation is of 60 millimeter mercury. Now, suppose there is a control system operating which tries to correct this fall in BP. So, with the regulation, the system, what it does is it brings it to 80 millimeter mercury. So, it has tried to correct it. It is not a perfect system. Even if it has tried to correct it, it has not brought it back to 100 millimeter mercury. Anyways, so BP with regulation is 80 millimeter mercury. But still you see there is certain change, right, from the baseline. So, what is this change? And this change is known as error. That despite the regulation, there is some error. And what is the error? We have to do this 100 minus 80. So, this error is 20 millimeter mercury. So, how much has the system corrected it? See, without regulation change was 60 millimeter mercury, right? 100 minus 40, it was 60. With regulation, still there is some error or a change, that is 100 minus 80 is 20 millimeter mercury. So, correction is predicted change minus actual change. So, predicted change is 60 millimeter mercury, it is going to fall 60 millimeter mercury. But with regulation, the BP has only fallen for 20 millimeter mercury. So, correction is predicted change minus actual change with regulation. So, 60 minus 20 will do. So, that comes to 40 millimeter mercury, and there is some error, residual error, this value, that 20 millimeter mercury, and if we divide correction with error, so 40, this value 40 divided by 20, it is 2. So, gain of the system is 2. So, this is a measure of effectiveness of a control systems, and different systems have different gain. Remember this. So, for blood pressure, we have various control system operating. There is a baroreflex, then there is also regulation done by kidney, right? So, gain of the system of a baroreflex is different compared to that of the kidney control system. So, in summary, what we have seen regarding negative feedback system, that it has 5 components that we have seen. There is sensor, afferent, control system, efferent and effector. It monitors the end result of activity. Then most common homeostatic system, yes, you should remember that most of the systems try to bring back the value of the variable to a desired value. Then it has time lag which leads to oscillations. And there is something known as gain which determines the efficiency of the system, and the mechanisms by which it acts, it can be neural, humoral and neurohumoral. Okay, now let's move on to the positive feedback systems, which we had said that what will positive feedback system do, that if there is an increase in the input, it will further lead to increase in the output. And this output is fed back into the input because it is feedback, right? So, this output is fed back as input, but it is amplifying the value of the variable. On the other hand, if there is decrease in the input, positive feedback can also cause decrease in the output, and this is further decreasing the input. Okay. So, that is positive feedback system. So some common examples of positive feedback system which you will be dealing is blood clotting, then generation of action potential, parturition, ovulation and lactation. So these are the most common examples of positive feedback systems which you will be dealing, but there are various other positive feedback systems as well. So these will be dealt in their respective chapters. Now with the fundamentals of positive feedback what we have considered, you might have realized one thing, that if positive feedback is continuously increasing the value of the variable, won't it be disastrous? Because the value of the variable will go out of hand, it will increase too much or decrease too much. Yes, that's true. That's why in body systems, positive feedback works under a loop of negative feedback. So this is the positive feedback which we saw. Now, after a certain critical value of the output is reached, the negative feedback actually takes over. So this is the negative feedback which is operating. Okay, so to keep positive feedback under check, positive feedback always works under a loop of negative feedback. So that is the way to end positive feedback, so that the job, the physiology is carried out, but it doesn't go out of hand. Also, another way in which this positive feedback loop works is if you remove the input only, then the output will be controlled. For example, in childbirth, the moment the child is delivered, the input is gone to the system. So positive feedback stops there. Okay, so two ways by which positive feedback is kept under check. One, positive feedback always works under a loop of negative feedback, and secondly, the removal of the input only will lead to end of positive feedback. Okay, now let's briefly discuss feed forward control. So feedback, if you have understood the meaning, the output is fed back into the input. But here this is feed forward. So this feed forward actually anticipates changes in regulated variable. There the output which is by the effector is not fed back, right? So what is happening is, suppose there is a disturbance and disturbance is causing the change in the variable which is sensed by the sensor, right? But the disturbance itself, whatever it is changing, it is conveyed to the controller in this feed forward. So in feedback what is happening, that this variable changes whatever is the current value, right? It is being fed back, but in feed forward the change which this disturbance is going to cause, it is kind of an anticipation, right? The disturbance itself is sensed and that information goes to the controller. So based on the input from the disturbance, this controller makes anticipatory changes in the value of the variable, right? So we had seen that there is a time lag in feedback. In feed forward, this time lag is taken care of lot since it is anticipating the changes which can be brought about by the disturbance. So feed forward control has certain advantages. First of all, it is anticipating changes in the regulating variable. So that's why it improves the speed, okay, because time lag will be minimized. So it also minimizes fluctuations, because we said earlier that it is due to time lag that fluctuations in the system are there, what we said, oscillations, right? And feed forward is always neural, because hormones take a bit of time to act and neurons conduct very fast. So that's why this feed forward control is always neural. Examples of feed forward control system are increase in heart rate before start of exercise. So just by the thought process of exercise, the system increases the heart rate in preparation of upcoming exercise. Then smell of food causes increase in gastric secretion. The food has not yet entered, the stimulus has not yet reached there, right, for causing the increase in gastric secretion. but just by the smell of food, the system starts preparing your body for the upcoming changes. So that is also an example of feed-forward control system. Then suppose when you are feeling thirsty, why do you feel thirsty? Because there may be decrease in the body fluids or change in osmolarity of the body fluids. Then you drink lot of water, but still the water will not reach into the body fluids, right? It will take some time for absorption to occur. But the moment you drink it, you will feel as if your thirst is satisfied. And you also know the amount also, that okay, this much water you need right now, which will be sufficient for correcting the body fluids. So these are all examples of feed-forward control system. But again, feed-forward control system also works under a loop of negative feedback system. See, because the system is trying to make a change in the variable, anticipating and change in the variable, but there should be another check. Has the variable been brought into a desired value or not, right? So input, this is same, that input is fed into the controller and causing a change in variable, and the disturbance is sent to the controller, but again this variable is being sent back as input to the controller. So this is the negative feedback loop under which the controller is acting, the system is acting. So it acts as a check to know whether it is in the desired state or not. So what is the summary of our positive feedback and feed-forward mechanisms? Positive feedback loop is used for switching states quickly. So suppose we consider blood clotting, right? So from the fluid state, if the blood needs to be clotted, it will be done very fast by positive feedback loop. Then it can be disastrous if goes uncontrolled, because it is viciously increasing the value of the variable. Feed-forward control, on the other hand, senses the disturbance and anticipates changes and makes corrections accordingly, and both positive feedback and feed-forward systems work under negative feedback system to know that the variable is in the desired state. Plus one more thing, that this feed-forward system, what we had said, that it is anticipating changes. Now these anticipated changes also may change over time, right? So that is that feed-forward systems are capable of learning that what disturbance is causing how much change, and depending on that it will change the response of the effectors. So that is known as adaptive system. Okay, so feed-forward systems can adapt also. So friends, we have dealt with the homeostasis, then how it is maintained, and what are the various mechanisms of maintaining homeostasis. Thank you and have a nice day.